Hi, my name is Nina. I welcome you to the presentation of iArch, the innovative orthodontic arch system from SIA Orthodontic Manufacturer. In this presentation, I'll explain the main features of the system and why it's convenient to use iArch. First of all, we must resume the studies related to the physiology of dental movements, which indicate that the displacement of a tooth in the periodontium occurs through pressure on the one hand and tension on the other. When a force is applied to a tooth, the PDL is compressed on one side and stretched on the other. In this way, blood pressure decreases on the side where there is pressure and increases on the side where there is tension. The result is then bone resorption where there is pressure, while its formation where there is tension. Bottom line, applying force on the teeth creates a displacement that generates resorption and bone formation. But what is this proper force level and duration so as not to create damage? Optimal strength should stimulate cellular activity without occluding blood flow in the pedal. Therefore, the orthodontic forces range from 6 to 250 grams. Too high forces can cause damage and not result in stable tooth movement. The duration of the applied forces is the other important variable when considering tooth displacement. The movement does not begin until 6 hours after the application of force. The tooth moves between 6 and 24 hours. The longer the force is applied, the more the tooth will move. No movement will occur if the forces are applied for less than 6 hours. In conclusion, applying light forces for a constant and prolonged duration over time will induce a more effective tooth displacement. Each orthodontic therapy involves well-defined phases: alignment, leveling, torque insertion, space management, inter-arch mechanics, finishing, and retention. In the alignment phase, light forces and round arches are generally used, the diameter of which varies according to the tooth crowding. In the subsequent phase of inserting the torque, the forces applied are greater, and the arch is stiffer. A sequence of arches of different sizes is used, with a rectangular or square section. Unfortunately, this alternation of round and rectangular arches is often the cause of bone resorption, especially at the level of the vestibular cortical. Is it possible to improve this biomechanics? iArch is the answer to this question. iArch is an innovative system of orthodontic arches that use only rectangular sections with specific dimensions for immediate torque insertion from the treatment's early stages. Using specially designed sections and alloys in thermal copper nitide and superelastic nitide allows very light and continuous forces for greater effectiveness of tooth movements. iArch arches have an inverted cross-section compared to traditional orthodontic arches. The vertical dimension is, in fact, greater than the horizontal one. This allows for greater intrusion and extrusion forces than the torque one, thus generating biomechanics capable of producing a bodily movement of the tooth, greatly limiting the proclination of the crowns, which is one of the causes of bone resorption at the level of the vestibular cortical. The first arch has a 16 by 14 cross-section. Its enormous flexibility allows it to be engaged even in significant gaps between brackets. The special section and the copper nitide alloy ensure the release of continuous and very light forces. This arch allows the torque to be inserted simultaneously to the alignment and leveling steps without compromising patient comfort. In fact, despite the rectangular section, clinical evidence has shown the absence of pain for the patient. The second arch, 18 by 14, also with inverted sections, is used to complete the insertion of the torque and for the inter-arch dynamics that may be necessary. This arch has a greater strength, and its rigidity allows it to be used for space closure. The third arch is made of beta titanium and is used to finish the case. It can be replaced with a thicker steel arch if deemed appropriate. 4 good reasons to use iArch. First, the use of light and biological forces allows an immediate insertion of the torque, a dental expansion, and the reduction of pain and bone damage for the patient.